Aloha Kauai, this is your County of Kauai briefing for Tuesday, January 18th. Our thoughts are with our Pacific Island neighbors in Tonga recovering from a major volcanic explosion over the weekend. Here at home, our COVID case count continues to rise. Thankfully, vaccines remain effective at reducing severe illness, hospitalization, and death. Our 7-day case average on Kauai is now 230 cases a day, the highest daily average we have seen. Today, the Kauai District Health Office is announcing 283 new cases of COVID-19. Today's cases bring the number of active cases to 771, with 6 hospitalized and 7,691 cumulative cases. Thanks to everyone on our incident management team who worked on the holiday to open our testing center. With the high case rate due to the Omicron surge, many parents are asking if their keiki will be able to keep learning in the classroom. For an update, we're bringing in Department of Education Kauai Superintendent Paul Zena.
Thanks, Mayor. Our team is working to keep students learning in person as much as possible. We know that learning in the classroom is the best for students, and we're working to keep class settings safe and open as much as possible through this Omicron surge. I announced a new policy last week. Going forward, when schools are affected by COVID-related absences of staff or students, we will shift to distance learning only on a class-by-class and a school-by-school basis. The goal is to keep as many students in the classroom as many days as possible, while being prepared to shift distance learning on short notice when it is necessary. Only when all resources are exhausted, distance learning will be used until the students can return. Elementary school students will be affected differently than middle and high school students because the older students have multiple teachers. Elementary schools may need to shift individual classes to remote learning, while middle and high schools may be able to remain in person longer until staffing shortages reach the point where the entire school must go to remote temporary learning. Mahalo to all of our parents, students, teachers, and staff for working together, making adjustments, and making this work.
Thanks, Paul. The record level of COVID infection in our community is overwhelming Department of Health investigators. As a result, the Department of Health is making temporary changes to data reporting and case investigation. For details, we turn to Kauai District Health Officer Dr. Janet Berriman.
Thanks, Mayor. The State Department of Health has temporarily suspended some data reporting due to the influx of thousands of cases. In order to expedite the processing and reporting of positive cases, DOH is suspending the reporting of negative cases. This means the test positivity rate percentage and other testing-related data are not available at this time. The record COVID-19 case counts in recent weeks have prompted a change in case investigation. Case investigators simply cannot keep pace with the large number of cases. While we continue to attempt to reach everyone who tests positive, it's taking us longer to do so. Some people will not receive a call or text before the end of their 5-day isolation period. This means it's more important than ever that you take action without waiting to hear from the Department of Health. If you test positive, isolate yourself immediately at home and let your close contacts know. Tell your employer or school. Isolating yourself to slow transmission is critical to the safety of our community.
Dr. B, if someone tests positive on a rapid test or has symptoms but can't get tested, what should they do?
If you develop symptoms, get tested if you can easily do so. But if you can't get tested, assume you're positive. Isolate for 5 days and let your close contacts know. If you test positive on a rapid test, it's safe to assume you are positive. There's no need to retest. Isolate in your home away from others. Wear a mask if you must be around others in your household. Let your close contacts, employer, and/or school know. We are no longer able to identify and call close contacts. Instead, we're asking those who test positive to notify their close contacts. If you are a close contact of someone with COVID-19, you should quarantine at home for 5 days after your last contact with that person, and if you can, get tested on that 5th day. and everyone should be very careful about wearing well-fitting masks when around other people from outside your household.
A question from our viewers. Do people who have tested positive for COVID since their last vaccination have to delay getting their booster? If they do, how long?
No, there's no minimum waiting period. People who've tested positive for COVID can receive their booster vaccine if they're eligible for it anytime after they finish isolation and are feeling well enough. And remember, if you test positive, there's no need to retest later. Once your isolation period is over, you are no longer infectious.
Thanks, Dr. B. Demand for testing was high last week, but based on the past couple of days, demand seems to be slowly decreasing. However, the convention hall ticketing system will remain in place until further notice to help avoid any long lines and crowding. The convention hall is open Monday through Friday from 8 to 3:30 p.m. Our mobile testing van goes to a different neighborhood Wednesday through Sunday. If you have insurance, you can contact your doctor to get a test at the Wilcox or KVMH drive-through testing centers or through clinical labs. If you're a Kaiser member, you can get a test at the Kaiser Clinic in Lihue. Free tests without insurance can be booked through Lihue Pharmacy by visiting alohaclear.com. A full list of options is posted at kauai.gov/COVID tests. Boosters are now recommended for everyone 12 years of age and older. If you had Pfizer or Moderna, you're eligible for a booster 5 months after your second vaccine. If you had Johnson & Johnson, you can get a booster 2 months after your dose. The Kauai Hospital mobile vaccine van will hold a clinic this Thursday, January 20th at the Kauai Neighborhood Center from 1 to 5 p.m. It is open for walk-in vaccinations for individuals ages 12 and older for first and second doses, third doses, and booster shots. The Pfizer and Moderna vaccines will all be offered at no cost. This Saturday, January 21st, Ho'olalahui will host community clinics at their health centers in Waimea and Kapa'a from 9 to 11 a.m. These clinics are open to ages 5 and up. For a full list of locations for kids and adults, visit kauai.gov/vaccine. Mahalo, Kauai.